Welcome to the Feel Better, Live Better podcast. Our goal is to provide you insightful conversations about all things health and wellness. We dive into the stories, science, strategies that help you optimize your well-being, physically, mental, and emotional health. Each episode features engaging discussions with health experts, real-life success stories, and practical advice to empower you on your wellness journey. Whether we're breaking down the latest medical advancements, exploring holistic health solutions, or chatting about everyday habits that make a difference, our goal is simple: to help you feel better and live better. Tune in for inspiring narratives, expert consultations, candid conversations that bring health to life, one talk at a time.
If you enjoy our podcast, please like and subscribe and consider becoming a digital subscriber to the Albuquerque Journal to help us bring you more content like this. You can find this episode and all of our podcasts on the Albuquerque Journal website, abqjournal.com, as well as YouTube, iTunes, and Spotify. See the show notes for a discount code on a digital subscription. Thank you for supporting the Albuquerque Journal, New Mexico's leading news.
Welcome to the Feel Better, Live Better podcast. Today we're talking about neurotherapy, a fascinating treatment that focuses on resetting the nervous system to allow the body to heal. Joining me is Barry Stanford, certified family nurse practitioner, who practices neurotherapy and incorporates principles taught by Dr. Kristi Fury, a pioneer in biological medicine and nervous system regulation. I hope you find this conversation as informative as I did.
Beyond Health is dedicated to helping patients achieve a life of health. Our passion at Beyond Health is transforming your health so you can live the very best life. Beyond Health can be your partner in your journey to optimal health.
Well, I am so excited, Barry. It's been a long time coming, you being on the podcast.
Yeah, I'm excited.
You know, it's been such a great opportunity and a pleasure to have you with me at Beyond Health since 2021.
Yeah.
So why don't you introduce the audience, introduce yourself, and we'll get started.
Okay, great. Yeah, so I'm Barry Stanford. I work with Kristi at Beyond Health. We're both providers over there. We've been there since, 2021 I started, and it's been really exciting to see the clinic grow and, just the amount of things that we've learned and the patients and stuff we're doing. So obviously we've been doing hormones and all the peptide stuff for years, but I'm excited to talk about neurotherapy and how we've introduced that into the clinic too. Yeah.
So that's today's topic. So for just a general listener, if they've never heard of neurotherapy, from a patient perspective, tell us what neurotherapy is.
So neurotherapy is basically just helping to reset what's called your autonomic nervous system. And your autonomic nervous system has two sets. So people talk about your fight or flight and your rest and digest. So this is a therapy that can kind of help pull you out of that fight or flight into rest and digest, to relearn or reteach your nervous system to kind of be at an equilibrium.
Mm-hmm. Yeah. So we got trained, or I know you did, with Dr. Kristi Fury, who's in Georgia, and kind of definitely the pioneer in this area, it seems like. Just tell the audience a little bit like what you learned, what was your big take homes as far as what made you excited to bring back neurotherapy to Beyond Health?
Sure. So first of all, neurotherapy isn't a new thing. It's been around since like the early 1900s. It's just not well known here in the States. It's big in Germany, Switzerland, China, just in Europe in general. So Dr. Fury brought it on in her practice, I think like 10 years ago or something. So she started certifying people in it. And what was exciting to me, I guess, I realized it but didn't really thoroughly understand how much the autonomic nervous system touches everything in our body. It regulates our hormones, our brain, our sleep, our cortisol levels. Yeah. So it's essential, and we are all in this really hyperactive fight and flight state most of the time, and how detrimental that can be to our bodies.
Yep. So from Dr. Fury's teaching, why is the autonomic nervous system considered the master regulator of healing?
So it's that exactly of where every single system is touched by the autonomic nervous system. It regulates how we think. It regulates our circadian rhythm and how we sleep. It regulates our cardiac function. It regulates our thyroid function or hormone production. So if we're in this, it's called a depolarized state at the cellular level, our body is so focused on just surviving that it can't focus on true healing.
Yep.
So it doesn't allow us to settle. We're not constantly being chased by a tiger anymore. Yeah. And that's what it does, is it shunts blood flow away from the non-essential organs so that we can survive. And we don't need that to be happening all the time anymore, which can be detrimental to our health if we're in that state
100%.
chronically.
Yeah, that stress. So what substance are usually typically used in neurotherapy injections? And why are they effective? And we'll do a little bit deeper dive, but just again, when you are doing a neurotherapy at Beyond Health, what does that consist of?
What are we using? So we're using something called Procaine. And the reason we use Procaine is it has a lot of extra properties to it, which we'll talk a little bit more about later, but it's very short acting. So it makes it very, very safe. There are some other places that are using something called ropivacaine, and that one is a longer acting substance, and that really needs to be done kind of under general anesthesia and in a pretty intense setting. But this one, Procaine, it's in your system for 20 minutes, then it's gone out of your system. So very, very safe.
So when Dr. Fury, she often talks about the nervous system getting stuck in dysfunctional patterns. Can you explain to the viewer, what does that mean?
What does that mean? So that goes back to, when you are in a very stressful, scary, life-threatening situation, everything is heightened. Your senses are heightened. Your blood flow is shunted away from your gut, and it's really focused on making sure that your blood is flowing, your brain is working, and you're really, really, really hyper-focused so you can get out of a bad situation. And that's good temporarily. When we're in that chronic state, it doesn't allow our body to do all the processes that it's supposed to do. So it's leading to a lot of chronic disease, especially in this post-COVID world, right? Which is what we learned a lot about at Calm, even more so. It's just our bodies really don't know how to go back and forth anymore, which is leading to this chronic fatigue and sickness.
So I think that's a great, so how can just even scars, chronic injuries, chronic inflammation living in this post-COVID world that it's here to stay. How can that interfere with normal nerve signaling?
So we're going to be hyper-focused on a certain state. So using scar, for example, right? If you have a traumatic scar from a surgery or something, your body is still focused on that area and trying to heal it. Because as you know, scar tissue, it lays down for years and it changes, scars remodel. So our body's hyper-focused on, oh gosh, this is still a threat and we still need to take care of it. And even more so, it's interesting, they've shown that if that scar is related to a traumatic event, then your body is going to be even more focused on that area. So you got to release that area and let that settle before the rest of your body can settle.
Yeah. No, I think for me, that's what's been so fascinating is the autonomic nervous system, how it can influence inflammation, immunity, healing. Just like what my mom is going through right now as far as how doing the neurotherapy on her has just helped kind of reset that nervous system that she has in this, as you mentioned numerous times, that fight or flight state. But it's really starting to heal. What types of conditions respond best to neurotherapy? What have we been doing? Even 8 months, 6, how long have we?
It was the fall that we
okay.
did the training, so yeah.
So since we've been doing it at Beyond Health, what types of conditions respond best to neurotherapy that you've seen clinically?
So anxiety is a big one, people with, and that's a pretty clear one. So chronic anxiety, depression, insomnia has been an interesting one to see. And just, a lot of times that takes time to start getting that to reset. But people will come in and do a treatment and they'll actually sleep that night, which is really exciting. Chronic pain is a big one, and that chronic fatigue syndrome. And I think just those people that we've been working with for years that we feel we're not quite breaking the surface. We know their labs look good and we have them on all the right things, but they're still symptomatic. those are good candidates to see if, well, maybe we just need to do a little bit of a reset so their body can actually accept the other therapies we're working on.
I think for me, what I've noticed is the patients with a truly disruptive gut-brain barrier access.
Yeah.
I think, a patient you and I work with, comes to mind how she's responded well. That's had, kind of her whole life, some significant gut dysbiosis. And it seems like the neurotherapy injections have absolutely helped. So go a little bit more into how does the neurotherapy help with chronic pain? I think that's an interesting to kind of go a little bit deeper.
It depends on where the pain is coming from. A lot of us are walking around with all the tension in our shoulders and our neck. And so you can do the injections in Procaine, which I had been doing trigger point therapy for years right at the clinic, but now we've switched over to Procaine to help with reset that muscle tension. And what it is it's basically a sodium channel blocker. So it's helping to change the way the system is communicating with the rest of the body to let it reset. So it's also a numbing agent, which is really nice because when you're doing an injection, the area that we're doing the injection is numb almost immediately. So it's a relatively painless process. Other ways is some of the chronic pain, like you were talking about with the gut stuff, is if we're holding this chronic pain in our pelvic area. You think women with endometriosis, fibroids, those things is their body's once again really focused on that area. So you can inject the Procaine over different nerve bundles to help that system calm down so the communication with the brain and those pain signals change and decrease and start to quiet a little.
Yeah. Tell us a little bit what I always think is the digestive issues of how it improves. And what's fascinating to me is when we do the neurotherapy IV and also the block, right? How immediately you get that gurgling in their stomach. So just explain a little bit more for viewers that are interested as far as how is that helping the digestive issues, gut?
So one of the big things it's working on is the vagus nerve, which, go back to master regulator. Vagus nerve regulates everything, and it's all going through that central part of our body. So back to waking up those systems again. Our digestive system is one of the first things that our body actually starts ignoring when we're in that chronic stress state. We have less circulation. It shunts the blood flow away. So therefore, things can't move as well. Things don't digest as well. And that's what, chronic constipation. And it's interesting with the Procaine, once you've done a couple of treatments on people, how you just kind of come near them with the Procaine and you can hear them start to gurgle a little bit. And, we have a mutual friend who did a couple, and she called me the next day and she's like, "You made me poop." And that's, it's a big deal.
It's a big deal.
It's a
so
really
many women don't, as you and I know.
Yeah. So just getting that motility back is huge for people, and that changes your mood, right? Because that gut-brain, connection is important. The way that it's signaling from a serotonin standpoint is huge.
Yeah. And then what have you seen, like just treating a small area, like going back to your points with someone has some skeletal injury and you're doing trigger points with Procaine. How can that improve symptoms somewhere else in the body? Like, have you seen that clinically?
I have a little bit, and I think that's where the history of neurotherapy, it really took off. And don't ask me the name because I'm terrible at those things. But back in the early 1900s, in Germany, they were treating a woman with neurotherapy, and she had a frozen shoulder. And they couldn't figure out how to get that frozen shoulder to relax. And they decided to treat a surgical scar that was on another part of her body, and that cured the frozen shoulder. So it went back to that, well, her body was just so focused on this area, we had to let that release so that her body could take care of the rest. And that's, I think, the trick with neurotherapy is that if somebody has, they call it interference fields in that world, if they have that hyper focus on one area, if we don't figure that out, we can treat everything else and we're not going to get better.
Correct. So beyond symptom relief, what symptomatic benefits have you seen patients experience? Like, system improvements. Like if we're treating the gut or, anxiety, what have you seen other systems improve?
So obviously gut, right? Motility. Cognitive function, so brain fog significantly decreases. that circadian rhythm reset, so helping with sleep and sleep quality, right? Waking up actually feeling rested in the morning. Recovery from exercise, right? So it's that ability to actually take in the exercise and then allow your body to heal afterwards.
Yeah. I think what's as far as just it restores the nervous system, which improves things like the energy, the sleep, the mood. And I mean, even myself, like when you've done it on me, just I'm in a calmer state for a while. I just need to do it more often.
Yeah, we all need more.
Yeah, we all
procaine.
need more. Maybe we need to do procaine days at the clinic.
do, yeah.
Pick Friday procaine days.
No kidding.
So, as we know, neurotherapy plays a role in longevity and preventative medicine, which, is what Beyond Health stands for, right? So why do you think this was such an important therapy to bring on? Like, why do you think it's really helped us to actually treat patients better?
I think a couple of things. One is I didn't realize until I went through the training of how much it's really happening at the cellular level. With that's our whole goal, right? Let's get to this root cause of what's causing the issue and stop just putting Band-Aids on things.
Yeah.
And this addresses some of those root causes. I think the other thing is just, a lot of us and a lot of our patients are in these stressful, high-level positions, whether it's, you're a stay-at-home mom or you're an executive or you're on the go all the time. And that's also just kind of what we do culturally in America is we're constantly here. And so we don't ever have time to just bring it down a notch. And forcing that body just for 20 minutes to just let you rest. Allows you to open up and actually heal. So I think it has been a big missing piece because it is. I think anxiety is one of the hardest things to treat. Anxiety and sleep. And gut.
Yeah.
And this has been a game changer in that sense.
Yeah.
And it is. It's been interesting. Some people I treat, and you've seen this, right? You treat them, and then they kind of freak out because they're like, "Oh, I don't know how to relax. What is this feeling? Why am I not stressed?" It's sad to me to see that people really, we are in this state so much that relaxation is scary.
Yeah.
Well,
and it's just people don't know how to embrace. They don't even know what relaxation is.
Yeah.
I think it's, especially that talk at CALM that you and I were just at, the clinical application of longevity medicine in Fort Lauderdale. The title of Dr. Fury's lecture was why standard protocols don't work for an executive. And it's just to your point that, we have these high functioning individuals, regardless if they're attorney, a doctor, a mom, a teacher, a cop, whatever that field might be. We're all high functioning in certain areas that, as good of that, what we can do at Beyond Health as far as with peptides and hormones and supplementation and the other different therapies, that this truly has been a missing link to so many of our patients. And I'm grateful that you were passionate enough to go and want to learn more about it. So let's move a little bit towards the patient experience. So what happens during a neurotherapy session at Beyond Health? And let's maybe break up, the different types that you can receive it, and then we can kind of go from there.
So one is picking whether we're doing an IV or an injection series. And that's a hard one to figure it out. I think it's pretty clear when somebody has, back to the pelvic issues. I have endometriosis. Okay, well, we probably need to address that pretty clearly. But when we have just this chronic systemic stuff, it's hard to say, is an injection going to work better or an IV? So it's having a conversation with the patient first of what's going on, what kinds of things are you experiencing, do you have pain, where do you have pain, where is that coming from? So good thorough consult. And fortunately, we know a lot of our patients really well, so we kind of have that idea going on. An IV is pretty straightforward. The dosing varies, and I think that's what's really tricky about this therapy is there is no, oh, you're this weight, so this is how much you get. It's so interesting. This little tiny person, and they need a ton, and other people can give them one little shot, and they're down. So IVs, we usually start kind of at a middle of the range dosing, right? We ask the questions, kind of get an idea of how people respond to medications generally. It's a typical IV setting, right? We try to get them into one of our comfortable rooms and put some calming musics and sounds on, and they have the injection. Then we're having our MAs coming in and checking on you on a regular basis. Yeah. One of the things we're asking for is how you're feeling, because that's going to help us dictate how fast to run the IV, how slow, do you need a little bit more, do you need a little bit less? And then that will help us in the future kind of how to dose you. Sensations we're looking for is that feeling of relaxation. And it's a bad analogy. One of these days I'll figure out a better one, but we don't encourage drinking, but it is, a couple glasses of wine in level of relaxation. You're not out of it. You're not intoxicated, but you're relaxed, and it's kind of quiet. So that's the goal. And then that feeling tends to last for about 20 minutes after an IV is over. So through the IV and then afterwards.
And then talk a little bit about when you choose the injection.
So injections are going to be a series of injections, and we may do different injection sites each treatment, depending on how you respond. We talked a little bit about the trigger point injections, which are just kind of going, above and into different muscles to help muscles relax. But the big ones are going over nerve bundles. So they're called ganglions. And we have several in our body. We have some in our face, our neck, stomach, and then our pelvic area. And so it's basically infiltrating the procaine over those different nerve bundles to help that system calm down. Those are relatively painless injections. I mean, it's a tiny, tiny little needle. We're not going super deep. We're not actually injecting into anything. We're allowing the medication to flow over, right? So, and like I said, procaine is such a fast-acting numbing agent that, that little poke, we put a little bit of numbing in, and then you're totally you don't feel anything afterwards. Yeah, so it varies on where we're doing the injections. If somebody has a gut issue, I'm definitely injecting into that gut area. Now there's BMI concerns, people who have, too much visceral fat. We can't quite get there, but there's other places we can go there.
Yeah, no, I was surprised the first time you did my block in my neck that, I mean, it was basically painless. I mean, a little pressure and that was it. And wasn't uncomfortable. And I know that, again, this varies because every patient responds differently, so it's not like we have an exact protocol. But typically, how many treatments does a patient usually need?
I tell them a minimum of 5. But I think if you look at the studies for PTSD in particular, and this is pretty, severe PTSD, the things that they're doing in the VA, it's 18 treatments. Clinically, what Dr. Fury's team does is they say a minimum of 8 is really where you're going to get more of that. What I tend to see is those first 5 treatments, it's ideal if we can do it 1 a week or even twice a week as like a loading phase. And then you start to get more longevity out of the treatment. The first treatment, you feel better for a couple of days. Second one, maybe 3 days. By the time we're done with that first 5 or 6 treatments, we're getting like a week out of people. And then we just start pushing it out. You feel good for 2 weeks? Okay, let's do it every 2 weeks. Maintenance is, once a month, once every 2 months, or you can even go longer and you have a stressful event and come in and do a treatment.
And I think that's, I just saw it clinically with my mom, with, her dealing with her eye trauma that's created a significant amount of PTSD. To your point, like that first time, it worked great, but it maybe lasted a few hours. And now she's probably had 5 or 6 treatments, and today she's still seeing the benefits of what she did earlier this week.
That's awesome.
So I mean, I totally agree with that. What changes, like when you're talking to a patient for the first time, what do you tell them that they will often notice that initial treatment? Because I think the initial, anytime, regardless, whenever patients come in with us with the procedure, it's, there's some hesitancy, there's some, as we want them to be. I mean, to be honest, like we want them to ask us questions. So what is usually that first experience? Like, what is that first symptom that they see?
Well, first thing I warn them is that the first swing, maybe we'll see nothing. And that's actually feedback for us, right? That's diagnostic for us. The goal is just that level of relaxation. Now, sometimes, we really want you to come in with food in your stomach because you can get a little bit of a blood sugar drop and feel a little shaky. That's an easy fix. Give you a little bit of something to eat and you're good to go. Some people feel a little lightheaded right afterwards. The biggest thing is when we're doing that stellate block in the neck, which is really, that one has tons and tons and tons of research on it. That one's really cool. You will get a droopy eye and a bloodshot eye.
Yeah.
And I think that if we don't warn people appropriately, that's distressing. It goes away. It goes away in the 20 minutes, sometimes a little bit sooner. It's a feeling of heaviness, and it looks funny, right?
Mine looked weird.
Yeah. But that for us, right? That's yes, we got it. It's that was a perfect bullseye treatment.
Yeah.
And it goes away. That's what I also remind people is the beauty of this medication is that it is cleared from your body in 20 minutes. Yeah. So anything that feels a little weird, if you feel a little uncomfortable, it's temporary. Yeah.
I think the other one that I noticed was the sinus congestion.
Oh, that's right. Yeah,
I
the drainage
immediately got that, and I was like, oh shoot. But no, exactly. 20 minutes before I went home, it was done.
Fine. The warmth is the other thing I think that a lot of people will feel is as they're doing the injection, and this is again more common in the neck, is they feel kind of a warmth going up the side of their face. The pelvic injections are interesting because that one you can get kind of they call it, metallic spider webs. So it feels like a cooling kind of down your thigh sensation. So every place has a little bit of a different
That's
sensation.
interesting. So I know, Dr. Free emphasizes the whole body approach, just like we do at Beyond Health. How do you combine neurotherapy with other therapies like nutrition, regenerative medicine, helping people live health?
Well, nothing's going to work. Nothing's a quick fix, right? Nothing's going to work if you don't take home and do your own work at home, right? If you don't do your homework, it's not going to stick. And so I think neurotherapy is beautiful, and I think it's amazing, and it's been awesome bringing it on the clinic. But it's not the only thing, right? We need to make sure that they're keeping their sleep hygiene. We need to make sure that their diet, they're not going and picking up fast food on the way home and eating a bunch of junk, or going and drinking. And you need to make sure that you're supporting your body and to recover. If your hormones aren't optimized, this probably isn't going to work long term either. So I think you got to look at the whole picture. It's incredible therapy, but just like anything else, it can give you a peptide, but it's not going to work if your body's not prepared to be able to do what it needs to do with it.
I think for me, it's just the neurotherapy, how it's enhanced the results of our other treatments. Like we've mentioned, just those difficult patients, and not difficult from a personality, but just we can't quite get through that barrier. And so much of it was just this autonomic nervous system dysregulation that maybe you and I it wasn't front and center in our brains, thinking this is the reasoning why we're not improving their moods, why we're not improving their sleep, or just even their ability to for exercise.
Right. Well, we didn't have the tool for it.
We didn't have the tools,
and I think that's what's always so hard in our world is we want to be able to fix everything. And there's some things that you got to figure out what the right tool is. And this has been a good one.
Can you share one patient story? I mean, obviously without mentioning names, that you saw a dramatic shift. Since we've been doing it, is there a certain case that really sticks out to you of we got it?
We got it. Well, one, the Parkinson's case. We're able to make tremors go away for 3 days at a time. We just started, so the hope is that we're going to get more longevity out of that one. That's a big one. I have another one that I've been taking care of her for months on it, and she loves her Procaine now. Didn't even realize that she had anxiety until she was like, oh, this is what anxiety is, right? And now she's able to better do her job. I mean, my first experience with it was really eye-opening. When I first had mine done, it was at the training. And you're in the training and you're trying to learn, and so I didn't really feel anything from it. I was like, well, probably just we didn't do enough. I didn't do it. But that night I got stuck in Atlanta traffic trying to drive home, get to the airport. I'd already missed my flight. My phone was dying. It was like 10% battery. We're in Atlanta, which apparently they don't have outlets in Atlanta airport. And normally I would have been very upset. And I would have tried to take control of the situation. I called my husband. I gave him the information. I let him rebook my flight, which when have I ever let
When
go
have
of
you
that
ever done?
control?
That's a new one. I didn't even know this happened, Barry. That's a new one.
I didn't even realize like all this had happened until I was sitting on the plane later, and I was like, wait, that was not like me. And I mean, I was concerned because I wanted to get home, but I wasn't all in a tizzy, and I didn't feel like I had to take control. I just kind of let him do it, and he did it. And it was fine. Well, I think that was when it hit me. It was like, okay, this stuff works.
Yeah. Well, my next question was, what are some of the most surprising results? Well, there it is.
There it is. Yeah, Barry letting go of control.
Yeah, there it is. Barry letting go of control.
Yeah.
So just to kind of wrap it up a bit, who is if our viewers are listening, who is the ideal candidate for this neurotherapy?
It needs to be somebody who's receptive and who wants to do the work and who is willing to do their end of it. I mean, just like I think any patient at Beyond Health, you have to be willing to do all the outside work for it. And I think most people are candidates. There's not any glaring contraindications for this therapy. It's very safe. It can be used in lots and lots of different people. It can be used in teenagers with, horrible menstrual cycles. It can be used in patients with neurological conditions. If they're needle phobic, that's kind of hard. And I've had plenty that are, and we just try to give them a good environment for it. They have to be willing to let go of a little bit of that control and let themselves settle. But most people, I think, could benefit from some level of neural therapy. It's just having an open mind. And it's not a quick fix. It's going to take us some time.
It's a journey. So that was so there's really no patient that should avoid this? Like, is there, in the training with Dr. Fury, like, did she say, is there anyone that or any, like, disease state or someone's on chemo or, like...
There's no glaring disease like this you can't do. There are some preliminary stuff, and it's European studies that it actually could be beneficial from a cancer standpoint. But I'm also a firm believer that if we have somebody with an acute illness, something like cancer, we need to have the oncologist on board. We need to make sure that the whole team knows, and we need to clear because that's out of my wheelhouse. I don't understand chemo meds well. And, Procaine doesn't really interact with anything, but we need to be really clear. So if you're under the care of specialists and you're taking intense medications, I think we need to have a conversation.
I agree.
Yeah.
So what excites you the most about the future of neurotherapy, not only in general, but specifically at Beyond Health?
I think it goes back to we're finally getting improvement in people that we've been kind of stuck on for a while and helping people live that life that they're really desiring, right? Like truly being able to, be more present and be a better spouse and be a better parent because you're calmer and you're able to walk through the world with a little bit more clarity. And, I think that's always our goal is if we can get, better, happier people out of this, I'm excited.
Yeah. No score.
Yeah.
Well, as always, like I said, this is long overdue that you needed to be on this podcast. And it excited me to even bring the topic because I know that you're very passionate about this. And you've made an impact already with the short amount of time that we've been doing it at Beyond Health. I mean, you've already made a huge impact on a lot of families and patients and myself and now my mom.
Yes.
So thank you. Thank you for joining.
Thanks for having me. I appreciate it.